Hello everyone. Today we discuss about the spreading of cancer, myth versus the reality of spreading of cancer. First of all, you know about cancer is not a contagious disease, okay, and metastasis is happen within the patient itself, not to other. So we discuss about those things. First of all, most important message: cancer cannot catch to person from the cancer patient by the touching, hugging, sharing food, kissing, sex and breathing in the same air. First at all, first question that touching spread the cancer? No. Touch is not transmit to cancer from the patient to another person. So touching or holding hand or caring of a cancer patient not transmit the cancer from patient to normal person. Sharing food can spread the cancer? No, does not transmit the cancer. So eating with the cancer patient, you given the moral support to the patient because cancer cell cannot transmit from the food to another persons. And sex is spread the cancer? False, does not transmit the cancer, but sexual transmitted virus or bacterial infections that are transmitted from one person to another person. So example, if a female having the cervical cancer and the sex with a normal person, that not transmit the cervical cancer cell to the person, but that HPV virus that is to be infected in female, this transmitted from the female to male from for unprotective sexual conditions. So that is to be happen, the virus is to be transmitted, but cancer cannot transmitted from the sexual spread. Kissing is spread the cancer? No, there is no transmission of cancer cell from the kissing on the close contact with the cancer patients. So that is another myth. Cancer is spread through air or coughing? No, does not transmit the cancer. Cancer is not spread by the coughing, sneezing and breathing with the same air or living in the same environment or the same home. So we discuss cancer not spread by the touching, not spread by the food, not spread with living in the same environment. So how it is to be happen? Why cancer is to be spread? So cancer mostly spread within the same person. This is called the metastasis. Cancer is not a contagious disease. And how it is work? Because the cancer is to be spread is one person to another person by the blood vessels, by the lymphatic or by the direct transmission or the infiltration of the nearby cells. So primary from the tumor, blood and lymphatic that show the distance organ to be met. And why that distance organ is to be metastasis? Example, the cancer of the GIT or the food pipe is mostly spread to liver. Why it is to be happen to going to liver? Because that blood supply of the all organ going of the all GIT is go to most ofly to liver, and after liver that is going to heart. So liver is a one side. So liver giving the proper environment to the cancer cell, okay, and that like the addition, like the proper nutrition, proper oxygen, and so the cancer cell stick here and giving the metastasis to liver. Okay, so that is to be local invasion is to be possible, and that is to be intravasation going by the blood vessel. So survival in circulation by the protection from the immune attack, suitable environment of distance metastasis. Okay, extravasation that out of blood vessel is to be going on, and colonization is a particular place because the cell is to be survive and recruit the support in new organ. So colonization is to be happen and metastasis going to the another organ. Okay, so we discuss about why does the cancer prefer the certain organ? Because microenvironment, blood flow, adhesive molecule, immune cell growth and the signal influence that all favor the metastasis, and the metastasis development is a particular organs. Cancer can be transferred between the peoples. That is a very important thing. So ordinary contact like the touching, kissing, sexual transmission, living in the same room and eating with food to cancer patient, that is called ordinary contact. So cancer is not transmitted from the ordinary contact. Some rare medical exception like you transplant a cancer organ to other, or exceptionally maternal fetal transmission is to be reported. Extremely rare exception that cancer to be spread from the one person to another. One example is to be recently in research papers and in news also. The one sarcoma is to be spread from the cancer patient during the surgery to doctor. So but that is not a ordinary type of contact. So in daily routine life, in ordinary contact, cancer is not to be spread to one person to another person. That is clear cut things. But infection from the cancer patient can be spread by contagions to another person, like the HPV virus, Epstein-Barr virus, HIV infection, some like Ascaris and Schistosomiatum hematobium, and that some time of the cancer infectious agent that is to be transmitted from the one person to another person. But cancer itself is still not contagious disease. So why we should instead or isolation to the patient? When we know about that after this topic, cancer is not to be spread by the talk, by the hugging with the patient, and by the kissing to patient and living the same environment and eating with patient. So we not isolated the patient, we just prevent tobacco, we healthy weight, activities, vaccination time to time, and detect if the symptom is to be happen, and detect earlier to cancer in actively involved in screening programs and other medical evaluations things. So we reduce the incidence of the cancer, but not reduce incidence of the cancer by the isolation of the patient, because cancer spread awareness show that touching is not to be reason for the cancer spreading. Sharing food is also not a reason. Sex is not a reason. Coughing is not a reason, and the kissing is not a reason. So metastasis inside the body is to be happen, not the root of the cancer transmission to the another person. So infection is to be going on by the contagious diseases, but cancer itself is not going to. So that is a stigma. So science is more over to stigma. So cancer patient needed your support, not needed the isolation. So after the today's topic, you thought that cancer is spread biologically within the body by the invasion, by the metastasis, not socially from one person to another person. So please replace the fear with the science and early care of the patient. So cancer is not contagious. So real spread is from the invasion, lymphatic, blood-borne metastasis within the body. This is all thing is to be sourced by the WHO Cancer Fact Sheet in 2026, American Cancer Society, and the NCI Cancer Biological Source. So cancer is not spread. So please take care very well about the cancer patient. Thank you.